Good evening to one all present here. I welcome you all to the lecture series. Before that, I would like to give a brief introduction about Panchajanya. Ma'am, can you mute your mic, ma'am?
One second. Are you in live?
Okay. Panchajanya, the divine count of Bhagavan Sri Krishna, which was blown during Kurukshetra, indicating the start of Dharma Yuddha that followed. All the efforts were done for the establishment of Dharma. Dharma was kept over personal relations and motives. Keeping the same motive in our organization, we will work towards establishing the importance and necessity of following and imbibing Bharatiya culture, accepting our roots, and making people realize the true essence of Ayurveda, not only as a treatment modality but also as a way of life. All these while walking in the path of Dharma. Hence the motto Shreyam Bharatiyam Arogyam Ayurvediyam. The founders of these organizations started this because we felt the need to spread knowledge of Bharatiya culture, Ayurveda, the true history of Bharata Rashtra, and values to all stratas of people in and every corner of the world. Also, the founders, being Ayurveda aspirants, know the inside out of today's medical field. Hence, they aim to make people aware of this and also try their best to solve this on the go. With this aim in mind, I would like to welcome you all to Pragnavaridhi lecture series, conducted for first year students. Today we have Vaidya Seena Nair, ma'am, and ma'am is currently working as the assistant professor in Department of Rachana Shareera at Emmanuel Arcer Ayurveda Medical College and Hospital in Tamil Nadu. We welcome you, ma'am. Will be taking the topic osteology. We welcome you, ma'am. Handing over the session to you, ma'am. Can you unmute, ma'am?
Thank you. Thank you for having me here. I should thank the organizers and Dr. Sachna for recommending me for this session. And I should thank my Emmanuel Arcer family for helping me to conduct this session. And I should thank my principal sir also. We'll move to our presentation. Okay, today I'm going to take about osteology. So we are discussing regarding the topics which is coming under osteology. You all know that it is coming in the paper one. So all the students are complaining regarding one thing is that, ma'am, whatever we are studying, we are forgetting. This is the comment we used to hear from students every time. So or every time we used to say, what is happening to you? Why you are not able to write the things? So all the students will say that, ma'am, we are studying, but we can't write in the paper. That is the issue everyone is saying. So we'll make means a try to remember the things. Okay, we'll move to that. So what the mark distribution you can see from this osteology and Shareera is 16 marks, and you can see one question from MCQ and one question from short answer and one question from the long answer. So the blueprint will comes like this. You will get 11th question in the MCQ as the from the osteology and as the Shareera, and also a short question and a long question. As I said, it is coming in the paper one. The topics which we in the syllabus we can see is bone structure, types, and ossification, and description of each bones with its clinical anatomy. So we can divide the osteology. I mean, as you all know, in the syllabus, the topics are divided into must to know, desire to know, and nice to know. In the osteology portions we can have only two. There is nothing like nice to know. We should must to know topics and desire to know topics. In the must to know topics, we need to discuss regarding all these topics, like explain the skeleton and its importance, describe the uses of bones, describe and demonstrate the process and depressions of various bones, describe the characteristics of bones, describe and demonstrate cranial bones and its applied anatomy, describe and demonstrate pelvic bones and its applied anatomy, describe and demonstrate vertebral column and its applied anatomy, describe and demonstrate thoracic bone and its applied anatomy, describe and demonstrate clavicle and scapula and its applied anatomy, coming into the upper limb bones and lower limb bones with its applied anatomy, radiological structures with radiography. This is the things you must know. So the questions may be coming more from here, these topics. And also desirable to know topics: development and ossification, facial bones and its applied anatomy, phalanges, carpal bones, tarsal bones, its applied anatomy, pectorala and applied anatomy. So these are the things coming under your syllabus. So we are moving to the topic. The skeleton is a complex of hard structure that is a mesenchymal origin and possesses a mechanical significance. So as you all know, the bone formation is from the mesenchymal cell. So they all, before studying anatomy, you should understand that the most of the terms are coming from the Greek and Latin. So if you understand the meaning of the terminology, it will be easy for you people to understand the topic detailing. So before starting your discussion, studying a topic, first you understand the word meaning, then it will be easy to get into that. That is the first thing we should understand, means what is the meaning of that, then it will be easy for us. It's from Greek and Latin, more of the words are coming, so understand the meaning, then it will be easy to study the things. So the term skeleton comes from Greek and its meaning is dried up. The skeleton system is for the locomotor apparatus. It is for the locomotion activity. With the help of muscle, the locomotion activity will be doing. So all the bones and articulation of the body make up the passive part of the locomotor apparatus. So coming to the osteology, osteon means bone and ology means science. So the definition comes: the branch of the anatomy that deals with the structure and function of the bone, that is called as osteology, where the structure and the function of a bone is dealing, it is called as osteology. We can concern with the study of bones is termed as the science concerned with the study of bones is termed as osteology. So you all know, in our body we have 206 bones, and each bone is considered as an organ of skeletal system. Coming to the function, as you all know, the function as main function is for the support, then protection, then movement, electrolyte balance, acid base balance, and blood formation. The question may be asking sometimes for the 10-mark question, sub questions may be there, because in syllabus they ask for the functions, so you should go through this also. Means sometimes for 10-mark 4 questions or 5 questions may be coming, in that the each part for that may be coming. So you should know the functions also. Coming to the terminologies, if you want to study a bone, we should know the terminology, means terminologies which is used there, then it will be very easy for us. So here we are subdividing the terminologies into main 4 categories, that is articulating surfaces, depressions, projections for tendon and ligament attachment, and openings and spaces. So the all the bones means terminologies comes under this. Means articulation means the two bones where it forms a joint, there it is considered as the articular surfaces. So that articular surface mostly have the terminologies like condyle, facet, head, trochlea. We can see the condyles in the in case of knee joint, we can see the medial and lateral condyle of femur articulating with the medial and lateral condyle of the tibia. So that is the condyle. Condyle is the term we can see in the lower end of femur and upper end of tibia. And also facet, it is a small, flat, shallow articular surface. So we can see the facets in the bones. And also you can see the head of the femur, head of the humerus, head of the tibia, head of the fibula, like that. You can see the head also. Trochlea, we can see a smooth, grooved, pulley-like articular process. So trochlea mostly we can see in the lower end of the humerus. So these are the words we should know. Then it will be easy for us to study the things. Then coming to the depressions, alveolus, fossa, sulcus. These are the words used for the depressions which is present in the bone. So when we coming to the projections for tendons and ligaments attachment, we can see the terminologies like crest, epicondyle, line, process, ramus, spine, trochanter, tubercle, tuberosity. So mostly we know the tuberosity, tibial tuberosity is there. When we coming to the tubercle, deltoid tubercle in humerus. When we coming to the trochanter, we can see in femur greater trochanter and lesser trochanter. When we are moving to the spine, we can see the spine of the scapula. Processes, we can see the acromion process in scapula. So, and also line, spiral line in the femur. So this epicondyle, if you are seeing, we can have the medial and lateral epicondyle of the humerus. So these are the terminologies when coming to the bones. So mostly these projections are formed by the attachment of or ligaments to that. When coming to the openings, you can see the terminologies like canal, fissure, foramen, sinus. So you all may know the foramens which is present, obturator foramen in the hip bone, and also fissures you can see in the skull bones, and sinuses also in the skull bones you can see. So that are the terminologies related to bone. It's very important to understand the terminologies. Then it will be very easy for us to study each bones. There will be common characteristics for bonds that will we discuss later. These are the terminologies mostly we can see that as we already discussed, the head, trochanter, condyles in the femur, and also epicondyles, all those structures. When we coming to the characteristics of bones, the different size and shape are there. I have bumps, edges, round ends, rust spots, pits and holes. Then there are places for the attachment for the muscles and ligaments, and blood vessels will be entering there. We can see the nutrient foramen and all for the blood supply to the bone. And also other characteristics as purpose for the skeletal system to protect the internal organs, provide rigid kinematic links and muscle attachment site, and facilitate muscle action and body movement. Coming to the bone, has unique structure and mechanical property that allow it to carry out these roles. Among the body's hardest structures, only dentin and enamel in the teeth are harder. A high vascular tissue and excellent capacity for self-repair and can alter its properties and configuration in response to change in mechanical demand. Means there is change in the shape. We can see some of the bone are having the irregular shape and all. When we study the classification, it's because of the attachment, and also it have the self-repairing nature. So these are the characteristics of the bone. You can see the changes in bone density after period of disuse or greater increase in use, change in bone shape during fracture healing and after certain operations, adapt to the mechanical demand placed on it. So these are the characteristics of the bone. When we coming to the important classifications, so there may be questions for from here also you may get for the 5 mark, also we can get for the 10 mark. It's very important. You may get the classification of bone, and it's sometimes for 10 mark you may get classification of bone and explain any bone. Likewise you may get the questions. So we can classify in this way. So time management is very important in the anatomy exam, as you all know. So we can do by making charts like this. It will be very easy for you to remember the things, and also for reproducing in the answer sheet also. So we can classify as 4 types on the basis of the development, types on the basis of region, types on basis of the structure, and types of bone on the basis of shape. So these are the 4 main classification. Means according to the development, how the bones can be classified. There are 3 classification according to the development, that is membranous bone, cartilaginous bone, and membrocartilaginous bone. When coming to the region, bone can be classified into 2. One is axial skeleton, another one is appendicular skeleton. We will see the details in next slides. Then coming to the type of the basis of structure, it can be divided into macroscopic and microscopic. Macroscopic is compact bone and spongy bone. When coming to the microscopic, fibrous bone, lamellar bone, woven bone, and dentin and cement bonds. Then coming to the shape, according to the basis of shape, we can divide into six types: long bonds, short bonds, flat bonds, irregular bonds, pneumatic bonds, and sesamoid bonds. So this is very important. You should study the how it is classified each for classification, and its sub classification should be studied. You may get questions from this. When coming to according to the shape, we can already we discussed it is divided into long bond, short bond, flat bond, irregular bond, sesamoid bond, and pneumatic bonds. This classification we can use when we are writing in, if we are getting a question from explain about femur, or explain about humerus, or explain about vertebrae, or ribs, anything for that also we, for the introduction part, we can write a point from according to their shape, or where it is means according to the classification we can write in that, whether it is an endoskeleton or exoskeleton, where it is a membranous ossified bone or a cartilaginous ossified bone, whether it is according to their shape. So all these point also you can include if they ask bone also. So according to their shape, already we discussed there are six classification: long bone, short bone, flat bone, irregular bone, and irregular bone, sesamoid bone, and pneumatic bone. So when we coming to the long bone, each bone consisting of a shaft and a two ends. That is the long bone. We can see this in the extremities, upper limb and lower limb. You can see the long bones. When we coming to the short bones are roughly cuboid shape. They distribute in wrist and foot, including the carpals and tarsal bones. And also coming to the flat bone consisting of two plates of compact bone with the spongy bone inside. And for examples are occipital, parietal, frontal, nasal, lacrimal, omer, scapula, sternum, and ribs. Coming to the irregular bones, irregular bones are greatly varied in shape, carry out different functions, and cannot be classified in a preceding like vertebra, sacrum, coccyx, temporal, sphenoid, ethmoid, zygomatic, maxilla, mandible, palatine, inferior nasal concave, and hyoid. Coming to the sesamoid, develops in some tendons in locations where there is considerably frictions, tension, and physical stress. They may form in the palm of the hand and in the sole of the feet. However, their presence and quantity varies considerably from person to person. Example for this sesamoid bone is patella. You may get MCQ questions. Which of the following bonds comes under sesamoid? Likewise, questions may come. Last year also in our university there was one question like that. So examples, MCQ question may get from these regions. And also one more classification according to shape, we can classify into tubular bones, spongy bones, and flat bones. We can first classify into three. That is according to shape. It's tubular or spongy or flat. The tubular again subdivided into long tubular bones and short tubular bones. These long tubular bones comes on the examples are humerus, radius, ulna, femur, tibia, fibula. Short tubular bones comes metacarpals, metatarsals, phalanges. Spongy bones comes the subclassification as long spongy bones, example sternum, ribs; short spongy bones, carpals, tarsals; sesamoid bones, patella, pisiform bones. When coming to the flat bone, it's subdivided into skull bones and griddle bones. Skull bone have the bones of the vault of the skull, and the griddle bones have the scapula, hippo. So you may see the classification as tubular. I mean, it's according to the shape. It have a shape of a tube. So it is again subdivided into long tubular bones and short tubular bones. So the long tubular bones having the most of the examples are the major bones which is present in the upper and lower limb, and the short tubular metacarpals, metatarsals, and phalanges. When coming to the spongy bones also, you can see the mostly the bones, the short spongy bones comes the carpals, tarsals. We are already included in the short bones also. So this is the another classification according to the shape. Then coming to the classification of bone, the skeleton divided into axial skeleton and appendicular skeleton. Means it's for the convenience of the study we are classifying it. Means the skeletons which is coming in the axis of the body, which comes under the axial skeleton. As you all know, you can see in the figure what are the things which is coming in the central axis of the body, that comes under axial skeleton. Central axis that will be coming under the axial skeleton. So we have the skull bone 22 in number. or auditory ossicle 6, hyoid bone 1, vertebral column 26, thoracic cage 25. Total 80 axial skeleton are there. You can see in that figure also the bones which is coming in the central axis. That's axis of the body, that is considered as the axial skeleton. When we coming to the appendages, means the bones which is attaching to the central axis, that is the appendages, that is called as appendicular skeletons. The bones which is coming in the appendages is considered as the appendicular skeleton. So we have the two appendages, that is upper limb and lower limb. In the upper limb you have 64 bones and lower limb you have 62, total 126. As we all know, we have 206 bones, 126 in the appendicular skeleton and 80 in the axial skeleton. This include the appendicular skeleton will be having the bones of the upper limb, lower limb, and the bony girdles like pelvic girdle and pectoral girdle will be there, which anchors the appendages to the axial skeleton. Means the appendicular skeleton articulate means will be articulating with the axial skeleton by the girdles which is present there. So we have the pelvic girdle for the attachment of the upper limb, and we have the pectoral girdle for the attachment of the upper limb, and the pelvic girdle for the attachment of the lower limb. So then after finishing that classification, we are moving to the structures of the bone tissue. There are two types of bone tissue, compact and spongy. By their name implies that two type of difference in the density or how tightly the tissue is packed. But the strength, there will be no difference is there, but the density and how tightly the tissue is packed, we are dividing into compact and spongy bone. Coming to the microscopic structure of the compact bone, the structural unit of the compact bone is the osteon. Osteon is the structural unit of the, means each osteon combined and will be forming the compact bone. So we have its structural unit of the compact bone is the osteon, or it we call it as Haversian system. So each osteon contains elongated cylinder originated parallel oriented parallel to the long axis of the bone. You can see in that figure, means that each circle you can see over there. So everything will be in the long axis, parallel to the long axis. Each osteon will be parallel to the long axis. And osteon is a group of hollow tubes of the bone matrix, one placed outside the next, like the growth ring of the tree trunk. In Ayurveda also we get the reference Acharya had considered as the Sara of the a tree for the means simile what Acharya had given. Same way here also we can see the each osteons will combine and they will form the compact bone. Similarly Acharya also explained in our Samhita. So osteons also formed in such a way. Each group of means one osteons, it is the structural unit, and combination of many osteons will be forming a compact bone. So each of the matrix tube is a lamella. It is formed, means each osteon is formed by the circular lamellas. It is formed by the bone matrix. The collagen fibers in a particular lamella runs in a single direction. Running through the core of each osteon is the central canal. There will be a canal in the center of an osteon that is called as central canal or Haversian canal. The canal contains small blood vessels, nerve fibers that serves the need of the osteon cells. And also you can see in this figure lacuna and canaliculae. The lacuna between the rings of the matrix, the bone cell, the osteocytes are located in space, that is called as lacunae. And canaliculae, the small channels radiates from the lacuna to the osteonic or Haversian canal to provide the passageway through the heart matrix. That means from one lacunae to the another lacunae, there will be a connection that is called as canaliculae. And also it will be connecting with the central canal also. So you can see in this figure the lacunae, canaliculae, osteon. In this figure you can see the same as that of the pith of a tree. Same way Acharya also explained. Coming to the microscopic structures again of the sorry, here it's spongy bone. The spongy bone is lighter and less dense than the compact bone, consists of the plates or tabaculae and bars of the bone adjacent to small irregular cavity that contains red bone marrow. The canaliculae connects to the adjacent cavity instead of the central Haversian canal to receive the blood supply. So in here you should know that the spongy bone is having the means a plate consisting of plates called as trabeculae. There we have the osteons for the compact bone. In the spongy bone, we have only the trabeculae. You can see in that figure that how the trabeculae is. And also the canaliculae will be there is no central canal. It will be connecting to the adjacent cavities. It may appear that the trabeculae are arranged in a have a fastenless manner, but they are organized to provide maximum strength similar to the brace that are used to support a building. The trabeculae of spongy bones follow the lines of stress and can realign if the direction of stress changes. Means according to the attachment, it may changes the spongy bones nature. Means whether they are and there are ligament attachment or the where the strains or whatever happens, the shape may be changed in the spongy bones. Coming to the histology of the bone tissue, we can see four main cells for the formation of the bone. The four cells are osteogenic cells, osteoblast cells, osteocyte cells, and osteoclast cells. We get to confusion which is forming the bone, which is means reabsorbing the bones. So for that, osteoblast B means building, osteoclast C means chewing. So you can means used as a mnemonics there. So osteogenic cells are developed into osteoblasts. These are the cells means osteoporogenic cells will be forming from the mesenchymal cells. They will be forming into osteoblasts. So he has already there. I told you the osteoblast B means building. From bone matrix, it will form the bone matrix. The osteoblast will be changing into osteocytes. It will maintain the bone tissue, and osteoclasts they will function as the reabsorption. So the bone is formed and maintained by specific cells and is in constant state of remodeling. Every time the remodeling will be there. Otherwise, there should be a remodeling should be there for the bone formation. Coming to the bone matrix, the majority of the matrix of the bone is composed of inorganic crystals called as hydroxyapatite and are composed of calcium phosphate and calcium carbonate. Hydroxyapatite forms a cement-like material that gives bone its hardness and strength. The combination of the collagen and hydroxyapatite allows bone to be strength and hard, yet somewhat flexible and elastic. So this is the content will be this bone matrix will be giving flexibility and elasticity to the bones also. So now we are moving to how we are going to answer for the questions if they are asking for uh, whatever questions, individual bones. We can't finish in 1 hour that things. So we will be knowing how we are going to answer a 10-mark question or a 5-mark question. What is the pattern we need to be used for writing the answers. So if you are getting any questions related to bones, means if they, for example, they are asking for humerus or they are asking for sternum or they are asking for a vertebrae, sorry, they are asking for any of the bones, you need to answer in a particular way. Then it will be easy for us to write also. While you are studying, you are maintaining a pattern like this, then it will be easy for you people to memorize the thing also. So introduction topic, introduction you need to write for the answers. So the introduction, if they are asking, for example, we can take us humerus or we will go for the scapula. So if you are taking the scapula, it's asking we should write the location. In the case if they are asking for the scapula, we'll write it is the bone belonging to the pectoral girdle. And what are the articular surface, to what bones the scapula is articulating. We know that the acromion process will be articulating with the lateral end of the clavicle, and also the glenoid cavity will be articulating with the head of the humerus. So you can go with the introduction part with that. And also when coming to the classification, then also you can coming to the classification according to the shape, which classification it will be coming. As you all know, it comes under the flat bones, and also the regional classification, pectoral region, and we can write the shape of that. Then coming to the parts, which are the parts, means parts for parts coming to that. And mainly what are the processes which is present there, what is the angles which is present, what are the surfaces which is present, that all things should be coming here. Mostly the parts we can write for the long bones, that's upper limb, shaft, lower limb, like this part we can write. When we coming to the flat bones, there will be a specific features for that. In case of sternum, if you are taking, it will be having manubrious sternum, body of the sternum, siphus sternum, like this three parts are there. So you should be familiar with all these parts, then it will be easy for you to write. Then after writing all these parts, then you should write the borders which is present there. Angles in the scapula, if you are taking, you should write the borders, what is present over there, what is the borders which is present, what are the surfaces which is present. Then you need to go for the attachments. You need to, which are the muscles which is taking attachment. First it's very easy if you are following the technique. As first you should be thorough with the bone, what is the shape of the bone, how it will be, the side determination, how the side determination comes, how you are going to distinguish. It will be useful for you for the practical exam, viva also, for the identification of bone. So means bone, it's available in our college also, so we can feel it, no. So feeling it is easy to understand. We are forgetting the things because we are not understanding what we are studying. That's why we are not getting all the terminologies. If we are, once we understood what is there, then it will be easy for us to study the things. Just we need to revise the things. So after parts, attachments you need to study. If you initially you study the muscles which is attaching to that, then you go for the which muscle is origin and inserting to that bone, then it will be easy. Mostly if you can see that some of the muscles in the means scapula, if you are taking in the medial border, most of the muscles will be means inserting into this. But when we take about the lateral border, all the muscles are taking origin, because it's taking origin from the lateral border of the scapula, then it is inserting into the humerus. So likewise you can see from where the joint is, means which joint is there, what is the movement that muscle is doing. Then from that only you can understood what is there. After that, writing all these things, you should draw the diagrams. It's very important, you will get mark for that. So you should don't forget after writing all these things. Then also you may not get the full mark. Actually anatomy is like maths. How we got the maths, for each step there is marks, no. Same way for diagram, for clinical anatomy, you will get the marks. So you should be thorough with the introduction part, then the classifications, then parts, then attachment, then diagram, clinical anatomy. So if all these points are there in the answer, means you will get means good mark for that answer. If we miss any of these points, then there is chance for reducing the marks. Clinical anatomy is again very important. So why? Because in the syllabus only you can see every bone they had given the importance to the clinical anatomy. So you should study the clinical anatomy. If you know the bones, everything, then if you study, if you are taking the some of the other structure, not only the bones, other organs or anything, if you are studying, you are not getting the things, go and see the clinical aspect. It will be more interesting if you are knowing the things in clinical aspect. When we start the dimensions, everything, if you are getting bored, then go back to the clinical aspect, read the clinical aspect, what is occurring to that. Then if we have the clinical condition, we should know the normal anatomy, isn't it? So for that purpose only we are studying the anatomy, for understanding the clinical aspect happening to that bone. Same way here also you should understand the clinical anatomy. Then coming to the long bones, how we can study easily means, all we know that the long bones comes under the upper limb and lower limb. It would not include the pectoral girdle bones and the pelvic girdle bones. It only includes the bones which is present in the limb regions. So in that also we have three parts. In case of humerus, if we are taking, it is having upper end, shaft and lower end. In the upper end, what are the structures? Again, what are the prominence which is present? You know what are the things? Greater tubercle, lesser tubercle, then head of the humerus, neck. So these are the structures which is present in the upper end. Then coming to the lower end, we know that there are medial condyle, lateral condyle, medial epicondyle, lateral epicondyle, and fossas, radial fossa, cornoid fossa, and also in posteriorly we have the olecranon fossa. So these are the main means terminologies what we can see there. Means in the articular regions, trochlea will be there. So that's why I already explained in the earlier slides that we should know the terminologies clearly. Then it will be easy for us to understand the things. While feeling that bone, while seeing that bone, we can understand which side. As in the side determination, the main feature we are seeing in the humerus is the prominent medial epicondyle. So where that medial epicondyle is seen, medial, it should be in the medial side. So from that only head should be medially. By that 2 points only we can determine the sides of the bone. And when coming to the shaft, we should know, it's easy if we have the bond with us. Then we can feel what are the borders: medial border, lateral border, posterior border, and also surfaces. If medial and lateral, then in between the medial and lateral we have the anterior surface. Between the medial border and the posterior border we have the medial surface. Between the, it's like a triangular shape. Most of the bone will be having a triangular shape. You just need to know where the borders are coming, only that much. In the case of femur also the same thing: medial border, lateral border, posterior border, medial anterior surface. So how that triangle is there, which side. But in case of radius or ulna, there comes the anterior border, posterior border, and medial border, or introtious border for the ulna. And means there we have the I know lateral border for the ulna, or an introtious border we will say. So likewise, only the structures will there will be the most important thing we need to understand, that we should know the terminologies. What are the terminologies? If we are good in that terminology, it's very easy to study the bones. There will not be any confusions or means any difficulty to study the things. Just long bone means long bone will have three parts: upper end, shaft, lower end. So what are the structures which is coming in the upper end? We just need to know. What are the things coming in the lower end? We just need to know. And the shaft, mostly the upper end and lower end will be having the case of the this thing articular with some of the bone. There will be a difference in the case of the clavicle. Clavicle will come under the long bone, but it is the only bone which is placed horizontally in our body. So it is having a medial end and lateral end. And so that you need to know the what is the specific feature which is present to that bone. That should be also included in the introduction part. It will also give mark for that. So that's the easy thing. First, you study the features which is present in the bone, then go for the attachment. Then it will be easy for you to understand the thing. Then go for the clinical aspect. Most of the thing happening to the bones are the fracture. At which site the fracture is most common, you should understand. Coming to the irregular bone, mainly if we are taking the vertebrae. Last year also in our university they asked for the cervical vertebrae. So vertebrae, there is chance. Hip bone, there is chance. If the thing is in case of hip bone and all, it's a detail. We need to study the three parts of that bone. So take it into small topics. Means if one day if you are studying ilium, next day you study for the pubis, then you go for the ischium. It will be easy for understanding the things. When we coming to the vertebrae, there will be typical vertebrae, atypical vertebrae. So you should understand the features which is present in the typical vertebrae, then go for the atypical. Then it will be easy. It's a irregular bone. So in that also you should go for the introduction part. After the introduction part, you should know the what are the things should be written in that, in the introduction, but also where it is located, whether it is axial skeleton or appendicular skeleton, according to shape, which is whether what it will be coming. So what, there will be general features, so you should know all these things, and you should write the clinical aspect, and also you should draw the figure for the all the questions which is coming for, from these anatomic proportions. Coming to the flat bones, sternum, when in the case of sternum, scapula, already we discussed all those topics. So, all the very best for your examination. Thank you. Any questions we can discuss now?
Hello, ma'am.
Hello.
Yes, ma'am.
Yeah. If any doubts, you can ask. Okay. Or else we'll
Yes, ma'am.
conclude the.
I'll just check the comment section, ma'am.
Okay.
Ma'am, so far there are no doubts, ma'am.
Okay.
If there are any doubts or anything, later on I will share the doubts with you, ma'am. You can reply to that,
Okay.
ma'am.
Okay. Thank you.
Yes, ma'am. Thank you for this beautiful session, ma'am.
Thank you.
I hope many are benefited from this. And since you have done it like mark distribution and everything was very clearly told, ma'am, I hope many will be useful and they'll be utilizing it, ma'am. Thank you so much for the session, ma'am.
Thank
In
you.
future
All the
also,
very best.
Panchajani, I would like to collaborate with you, ma'am, for more sessions like this.
Okay. Thank you.
Thank you so much, ma'am.
Okay.